March is our time. Endometriosis Awareness Month focuses on the almost 1 million fellow Australians that are impacted personally, professionally, and socially by this chronic inflammatory disease every single day. Today, we want to highlight a critical aspect of endometriosis that often receives less attention than the physical symptoms: the profound impact on mental health. Endometriosis affects every aspect of a person's life. Many experience anxiety, depression, and isolation due to chronic pain, diagnostic delays, and disruption to education, careers, and relationship. This mental health burden is equally debilitating as the physical symptoms. Professor Lisa van Niekerk will speak to the importance of mental health and the research Endometriosis Australia is supporting through your generous donations.
There isn't really a specific age that we see people with endo coming and wanting that support from psychologists, but what I would encourage is that it's not something that's left until the last minute. So particularly if you are a parent or a caregiver supporting someone with endo, encouraging engagement with mental health, as I said, whether it's a social worker or a psychologist, early in the piece is really, really important, because what the aim there is to learn some of the skills to create that buffer, given that we know our emotional well-being can go up and down at any given time. So really, adolescence is when a lot of people with endo start to notice some of those symptoms, and that's when we think it's an ideal time to be learning about pain science, pain education, mental health well-being. But definitely, if, for example, throughout your experience of endo, there's been any form of trauma, we'd encourage you to seek that psychological support as soon as possible, rather than leaving it and feeling like this is something I've just got to get through on my own. There can often be pressure to have the best gynae, the best surgeon, the best psychologist, but I want you to think about the word best as what's personally the best for you. So the surgeon who's the best for somebody else may not be the best person for you. The psychologist who's best for somebody else may not be the best psychologist for you. What you really want in your care team is a group of medical and allied healthcare practitioners who understand you, who know your personal circumstances, who know you, who else is connected to you in terms of your support team, so that they're working with your individual presentation. Because we do know with endo, although there are, some commonalities, 1 in 7, that there is also a lot of uniqueness. So we don't want a cookie cutter approach either to the management of endo. It really does need to be personalised to each person's set of circumstances. There are any number of reasons why someone living with endo may choose to go and see a psychologist. Now, in terms of seeing a psychologist, sometimes people might think, look, I have to go see a pain psychologist or I have to go see a clinical psychologist, but really it's any psychologist with an interest and, skills in working with women and their partners who are living with endo. So that may be a health psychologist, it might be a clinical psychologist, it might be a mental health social worker as well. So the reasons that you may go and see someone is often when GPs or gynaes are talking to you about seeing a psychologist, they may say, look, go along and see Lisa, she's going to help you work on the pain. Now, we can certainly work on the pain, but that's only really one tiny tip of the iceberg why you may come and see a psychologist. So often when I'm working with people with endo or their partners, what we're focusing on is the flow-on effect of the pain in all of the other areas of your life. So pain, if you imagine, is sort of sitting at the centre, but we know there's fatigue, there are other symptoms of endo. For, a lot of people, it impacts on sexual intimacy, it impacts on who they view themselves as in terms of the roles that may occupy. That includes within the family system, within work, within relationships, within friendships, because we all wear so many different hats. So you may go and see the psychologist to talk about the influence that endo is having on your ability to manage at work. You may go and talk to the psychologist about the influence that endo is having on your ability to really engage with a particular sport or other activity that's really, really important to you, something that you really, really value, that you feel is threatened a little bit by some of the symptoms of endo. You may also go and talk to a psychologist about some of the trauma that has been part of your experience of endo. Now, social media can be such a powerful resource for a lot of people living with endo or someone who's supporting someone who lives with endo. And the upside of being able to access information, the stories of others through endo, is it can help explain some of the similarities that you might be experiencing. You can find out new information, new trials that are available, research that's out there. One of the downsides is that sometimes, because social media, it has limited monitoring, sometimes there can also be a lot of myths or misinformation that's portrayed throughout social media. So one of the things that I often talk to people about is working out what level of engagement with social media or online support groups serves you best. So for some people, they may like to be what we sort of call a viewer. So I will read things, it helps me to see what's happening, I can see similarities, I can recognise differences in my story compared to that of somebody else's, but I actually don't ever engage. For some people, they may like to view and then occasionally engage. So they may make a comment, they may share a small amount of information about their own personal experiences. For other people, they like to use social media as a form of advocacy. So they'll share a lot more information about their own personal experience. They'll engage with others in terms of their personal experience. And regardless of the level that you take, the one thing that's really important to be mindful of is when to take that active engagement. If things are difficult physically or emotionally for you, sometimes reaching out to an online support group can provide that sense of stability and support. Sometimes though, depending on the information that you get back, it can lead to more questions, feeling like, oh, am I on the right track here? And so we really want to look at how much we're taking that information in and seeing it as a statement of fact versus an opinion. So one of the things that I often encourage people to do is when you learn something, when something sparks your interest, is take it back to your trusted team. Now, whether that's your gynae, GP, family member, your in-person support group, so that you can talk through the information to work out how accurate or relevant it is for your personal experience of endo. One thing that I recommend is that, particularly with endo, one of the things that we found is that for people experiencing that, they spend a lot of time getting really good at tuning out of their body. And what the research has shown us is that because that becomes a primary coping mechanism, it's almost like they try and disconnect from the neck down or disconnect from the belly button to the knees. And so what happens is their knowledge of their body, the way they view their body, unfortunately, it takes on a very, very different process. So they start to feel like their body is working against them, and it's something that they need to be in a constant struggle with. You know, in some of the groups that I run, one of the questions that we often do is we look at doing a body scan, and at the end of that, the people in the group are asked, if you could acknowledge or be grateful for one part of your body, what would that be? And it's often a question that's met with, some grief response, some, gosh, I've spent more time than I can think of actually trying to not acknowledge anything in my body, that it's really, really hard to actually connect with it. So the one bit of advice that I would do is to spend some time acknowledging the strength and the resilience that your body has, particularly in the face of endo. So that doesn't mean, I think sometimes we look at statements like body positivity, and it doesn't mean, I have to be 100% positive about everything, because that's actually not the reality. But what it does mean is also looking at all the strength and resilience, the courage, the skills that it's taken you to help get your body to where it is. So it might be just acknowledging that, look, things have been tough today, but my feet have got me to where they needed to go. Things have been tough today, but my heart, it's pumped the blood through my system. So it's really just taking one small thing and acknowledging it, so it doesn't feel like you have to be in that constant struggle with your body. It's also acknowledging something that's really good when somebody else wants to shift the focus to the negative for you. So sometimes it might be thanking that person for their support, but also acknowledging to them that actually this is the strength and the resilience that I've had, that's got me through this. So it's not that I've had a great team of doctors or I've had a great psychologist. Actually, I'm the person who's got me through this. And I think acknowledging that, showing some self-compassion, directing compassion back towards yourself is something that's really, really important. Through my interest in the research actually came from the experiences that I was having within the clinical settings. So a number of years ago, I worked with somebody who presented with pelvic pain, and that pelvic pain didn't have a diagnostic label at that stage. And she came along with a referral that, indicated that, look, please work with this person. Her husband would really like to be able to have more sex. That was the referral. So that, I was like, that sparked my interest. But really what it was somebody who had been experiencing pelvic pain for a significant number of years that didn't seem to have an answer. And so for her, really what we looked at was, okay, let's see how we can go about trying to help you link in with medical professionals that may be able to provide you with an answer. From there, we looked at the type of skills that she found useful in terms of managing that pain, but also in terms of supporting that emotional roller coaster that was attached to the diagnostic journey and also to living with persistent pain. From there, I started to look at the research around the psychological impacts of pain. I'd actually done my PhD in non-malignant pain, and that really had focused mostly on lower back pain. And so pelvic pain was something that was new to me. But from there, I started to see more and more people who were living with one form of pelvic pain or another. And it became something that I routinely started to ask whenever I'd meet with a new client. And I was really surprised by the number of people who would say, oh, yeah, that's exactly what I've been experiencing. Or, well, I don't know if it's pelvic pain, but sex is really painful, right? Or, I don't know if it's pelvic pain, but I have a lot of difficulties with my periods or with fatigue or gut bowel-based things. And so that's where my interest in the research really grew. And then through my role at the University of Tasmania within their postgraduate psychology training program, I was given an opportunity to start to really explore the role of research in endometriosis. So I've been really, really fortunate to work with a great team of researchers who are really passionate about endometriosis research. And so the grant from Endometriosis Australia will allow us to co-design a body compassion program for people living with endo. So what co-design means is that we'll actually be bringing together a group of people who live with endo across Australia, running workshops where they get to help us look at the materials that we may include within that body compassion program. And that makes sure that the program that we're designing is designed by the people who are going to get the most benefit from it. So as well as having people living with endo provide feedback and help to refine the materials, we'll also have a group of healthcare practitioners. So they're going to include psychologists, pelvic physios and dietitians who also work with people with endo out in the community, looking at the materials as well in terms of how they would use those within their practice to support their patients and clients. So co-design is something that's really, really important. So make sure that the program is going to be feasible. And I guess that brings me to the next part of that title, which is the feasibility and acceptability part of it. So it's really, really important for research whenever we design a program that's focused on a particular health outcome, whether that's changing quality of life, mental health, physical symptoms, that it's tested to make sure that it's in its best form. So what we will be doing for that is actually then inviting people within the Australian community who live with endo to make use of the program, where they are actually then accessing the program online. They're providing us feedback in real time about their views of the program, what they've liked, what they haven't liked, which particular tools or techniques are really helpful, so that we can continue to refine it. From there, ultimately, our long-term goal for myself and our team is to provide a program that can be accessed through platforms like the Endometriosis Australia website for free for people living with endo, because we are really acutely aware of the cost of healthcare for the community. And so we want to make sure that if you're living rurally, where you may not have access to psychologists, pelvic floor physios, dietitians, that you can access the same sorts of treatment that somebody who's living within a CBD area and has greater access to clinicians may be able to get. We also want to make sure that it's free, so that, it's not an additional cost to your healthcare costs that we know are already accumulating for people living with endo. Seed grants like Endometriosis Australia provide are really vital for many research teams within Australia. So a lot of the research that we do is what we would call unfunded research. So it relies on our institution, like the University of Tasmania or other universities, to provide researchers with in-kind time to conduct the research that they are really passionate about. Many research teams as well may not, for any number of reasons, sort of be eligible to apply for larger grants that the government puts out. So we really do rely on organisations like Endometriosis Australia to help fund our research. Our programs are often a lot smaller, but the research is no less important. So we really value those grant opportunities. So the other really important aspect of seed grants like Endometriosis Australia provides is they provide an opportunity for early career researchers and clinicians to access vital funds to support their research. So, in the most recent round of Endometriosis Australia grant funding, one of the grants went to a PhD student, and it's really hard as a PhD student to access grant funding from a lot of the larger grant bodies. So by making sure that the seed funding goes to early career researchers and clinicians, the other thing that Endometriosis Australia is doing is making sure that they're securing and supporting the future research endeavours around endometriosis, because research needs to continue, and with access to seed funding, it's going to really help with those early career collaborations, plus collaborations across institutions. So it allows different universities to work together, it allows different researchers to work together, which also helps to grow that endo research community.
This is why continued research is absolutely vital. We need better understanding of both the physical and psychological dimensions of this condition. Research helps us develop more effective treatments, improve diagnostic pathways, and create better support systems. With close to 1 million Australians affected by endometriosis, this research isn't just important, it's critical to the 1 in 7 impacted by endometriosis.